Good morning, everyone. Thank you for joining us for Voices United, the State of Women's Health in Lancaster County. My name is Brooke Smith, Director of Community Relations at Penn State Health, and I'm also excited to be the board chair this year for United Way of Lancaster County. It's such an honor to be here to facilitate such an important conversation about women's health in Lancaster County. Before we begin our panel discussion today, we're going to start with just a brief presentation from Christy Gizmot, Vice President of Resource Development at United Way, and she's going to share a little bit about Women United. This work is so meaningful, and the conversation today is really relevant as we near the upcoming Women United annual meeting. During that meeting, members of this giving circle are going to select grant recipients who are offering programs that will advance women's health in Lancaster County. At United Way, we believe that strong communities are built when every individual has the opportunity to thrive. We know that women's health is deeply interconnected to so many other things: economic stability, access to care, mental health, family well-being. And when we support women, we strengthen entire families, and not only entire families, we strengthen entire communities. Today, we are joined by an awesome panel of incredible experts who I'm excited to talk to and hear from today. Their perspectives stem from emergency medicine, obstetrics and gynecology, family medicine, and healthcare leadership. Our goal is to not only better understand the challenges that women are facing today locally, but also to identify opportunities for collaboration, innovation, and meaningful impact. Thank you all for being part of this conversation today and for your commitment to want to help advance women's health in Lancaster County. Before we jump into our panel conversation and introduce our panelists, I'm going to turn it over to Christy to share a little bit about Women United.
Thanks, Brooke. So as Brooke said, my name is Christy Gizmot. I'm with United Way of Lancaster County, and I am lucky enough to be a part of helping to run things for Women United, which is a giving circle of United Way. So Women United focuses on funding women's initiatives that support Lancaster County women, and specifically in the areas of health, financial stability, and education. So we are empowering women through philanthropy to then empower Lancaster County women who are in need through those areas. And each year we are able to grant dollars to organizations that are serving women in need in Lancaster County from the Giving Circle. And so one of the aspects of being a member is that you're able to help in the granting process. So to actually help select the organizations that receive the funding. We've had a record number of applications this year, actually, and we have a grant committee that reviews the applications and picks final applications to move to a second round, which is then where we present at the Women United annual meeting, and that's where members get to vote on who gets the funding. So this year, the focus of funding for Women United is health. So this topic is very relevant in our community. It's relevant for the grant funding round this year. And basically, becoming a Women United member, it consists of financial investment, so $250 or more donation annually, which can be paid out over a pledge. There's 2 meetings annually. There's the annual meeting that's always in May, and then there's a fall event, which is a social and service event. So we have a little fun, but we also do a service project, volunteering, packing, feminine products for homeless outreach. We do all kinds of different things. And it's just wonderful to have a community of women come together to support the community of women in Lancaster County. And I just quickly want to mention that the chair of Women United for this year unfortunately passed away recently. Her name is Kay Berkey. She passed away suddenly in March, and we are so saddened by this. She has been a Women United member for 17 years. So Women United which was originally called the Women's Leadership Council, was formed in 2004. So she's been a member for most of the time, and uh, we are going to miss her greatly. And so we also see this year's grant cycle as a real way to honor her memory and her legacy. Um, we have a meeting coming up, as Brooke mentioned, May 19th. That's the annual meeting. It is for members, but we do welcome guests. And so if anyone's interested in becoming a member or just attending the meeting to check it out and hear about some of the great women's health projects that are going on in the community, we welcome you. And all of this information will be sent out in a follow-up email. So the link to the event and how to become a member if you're interested. And we're always happy to have a conversation if you have questions. And so please feel free to reach out. And I'm excited for this conversation today, and for all the work that's being done in women's health in the community. So thank you to all the panelists here today.
Wonderful. Thank you so much, Christy. For those of you who are tuning in, if you have questions at any time during the conversation today, please feel free to put them in the chat. There will be somebody monitoring that, and hopefully we'll have a little bit of time at the end to circle back and answer a few of those questions. Okay. So let's go ahead and introduce our panelists, and I'll just kind of call you out. If you can just share your name, kind of the health system you're associated with in your area of expertise, that would be great. And I'm going to start with Dr. McDonald.
Hi, good morning, everyone. My name is Dr. Vanessa McDonald, and I am a board certified OBGYN, and I work in the Penn State Health System, primarily at Lancaster Medical Center.
Great. Thank you for joining us today. Dr. Smith?
Hi, my name is Laura Smith. I am a primary care provider and I work with UPMC in the Lancaster market.
Wonderful. Dr. Powell?
Good morning, everyone. My name is Erica Powell. I am an emergency physician by training. I currently also serve as the Vice President of Medical Affairs for Ephrata Hospital at WellSpan. I work at several ERs, Shrewsbury, Good Samaritan Hospital, Ephrata Hospital throughout the WellSpan system in my spare time.
Thank you. And Ashley?
Morning, everyone. My name is Ashley Lundy. I am not a physician. I'm an administrative leader, and I oversee 4 Penn Medicine Lancaster General Health, the women's and pediatric service lines, in addition to our community health department. Very happy to be here.
Wonderful. Thanks, everybody. So as you can see, we have a powerhouse group of professionals here for you today. Before we kind of dig into each of your areas of expertise, I have a question just to get us warmed up today. So when you think about the current state of women's health in Lancaster County, what gives you the most concern and where do you see the greatest opportunity for change? And this can be for any of you to kind of chime in on.
I'll start us off, Brooke. I think some of the problems are age old. Women as caregivers, as heads of household, often present late in care. And so they're delaying their own health to prioritize their families, their work, their children, their spouses, and other social needs. And so again and again throughout time, what we see in women's health is later presentations to the emergency department, lack of ability to get to the necessary primary care and other things. So I don't think things have changed much. And so one of the things that I'm hoping that we'll elucidate here today is how the community can help start to change that trend. But I will let my other colleagues also contribute here.
I totally agree with Dr. Powell. I'm just going to take a little bit of a different approach too. Just federally, the federal landscape has been so volatile recently, and for nonprofit service providers especially, It's been significantly challenging. This relates to federal funding for their own operations in addition to entitlement programs for their constituents. And so trying to make sure that especially women and families, but everybody in Lancaster knows how to navigate things that are available to them, and also for service providers to plan budgets and programs to meet the needs of these individuals. It's just been a challenging year. It's affected healthcare providers too, but in a different way. Generally speaking, our nonprofit service providers who are really meeting the needs of our most vulnerable in Lancaster County at the front line, they've been impacted the most.
I agree with what Dr. Powell said as well. One of the issues that I see most often in primary care is I have women who come in who say, listen, I've seen other physicians, and not all the time, but most often male physicians, and they told me, oh, you're just stressed or you're just anxious, and they didn't listen to me and they didn't take my symptoms seriously. That is one of the things that I hear most often from a primary care standpoint. I work in an office that is all women with the exception of one man. We are all mothers, so we have a very similar approach in our office, but I would have to say that just not being taken seriously. So in addition to presenting later in the course of everything, like Dr. Powell said, you wait till everybody else has been prioritized and then you present, and just not being heard and not being taken seriously.
And I think also to piggyback on what Dr. Smith said, from the GYN aspect, I see that a lot, especially with our perimenopausal and menopausal women. One, they've gone elsewhere, haven't really gotten their concerns addressed. We're just kind of dismissed and told, well, this is just something that you're going to have to face, you're going to go through in life, and everything is kind of just due to your hormones, but never really had a lot of providers kind of take the time to really delve into what the issues are, actually hear what they have to say. And so that has kind of prevented them from really wanting to seek any kind of help.
Yeah. Thank you all for weighing in on that. Certainly, I don't think it's lost on any of us that women are carrying a lot of loads, right? They're wearing many hats, doing many things. And, it's not surprising to me that women oftentimes are seeking care in later stages. So thank you for sharing those perspectives. Let's dig in. My first question is for Dr. Powell. So from your perspective in the emergency medicine standpoint, what are the most common reasons women in Lancaster County are seeking emergency care? And what do you think that tells us about the gaps in the broader healthcare system?
A lot of the presentations we're seeing are related to issues that are related, as one of the older adults said, to access to normal screening tests. So people are having chest pain, abdominal pain, and without good primary care access, those issues are ending up in the emergency department getting addressed in that setting. We do a lot of early GYN care as well. A lot of this has to do and is related to the health system's ability to provide off-hour access to these services. So it's not that our health systems don't have them available, but for people who have to work, it is very hard to get your regularly scheduled appointment to evaluate your chest pain or abdominal pain during normal business hours. And so healthcare systems really are trying to solve the problem of how to create access when it's actually needed. We're doing that a little bit on the virtual platform space, but I think there is a tremendous opportunity for healthcare to be able to meet people where they're at in order to address some of those routine complaints that individuals have. The other increase in uptick we're seeing is really in the mental health space. There is a tremendous amount of anxiety, depression, suicidal ideation based on the state of all of the social determinants of health that really plague the country at this point in time. So we've seen a substantial uptick in those complaints, particularly in women in the emergency department. And really, again, going back to not enough access in the outpatient space, in the off hours time frame to be able to have people address those needs. And then women are also bringing their children because they also need that care. And so they don't want to take their kids out of school. And so getting that sort of routine pediatric care for their kids in the emergency department.
Thank you. Ashley, question for you. From a systems and leadership perspective, what are some of the biggest challenges that you see in delivering equitable, accessible care for women in the county?
Thanks, Brooke. Well, so I'll name three. And the first two are related to healthcare provider organizations. And those challenges are provider shortages and cultural competence. So provider shortages are driven by a high volume of physician retirements, and particularly in rural and community health settings. We're also seeing trends in the way that younger physicians like to practice. They value improved work-life balance, reduced administrative burden. And so that's challenging us on the administrative side to make some adjustments to accommodate that. The state of Pennsylvania is not a state that is most significantly affected by provider shortages, fortunately, but community-based, non-teaching, and non-metropolitan settings, which Lancaster County is generally all three of those, can present additional challenges. And as it relates to cultural competence, so there's also distrust among some Lancaster communities of traditional healthcare organizations. And typically this is connected to things like language or cultural sensitivity and representation of that community within the medical setting. So the third challenge I'll say is patient related, and it's already been referenced a little bit today. It's connected to social barriers to access, so transportation, childcare. Those things can inhibit someone's ability to physically access care. There's other baseline needs like affordable housing, access to healthy foods, upstream drivers like education, employment. Those things can deprive many neighbors, especially in certain areas of our Lancaster County community, access to positive healthcare outcomes.
Yeah, thank you. And thank you for reminding us that there are so many factors that play into this, right?
Mm-hmm.
Yeah. Dr. McDonald, what are some of the most pressing maternal and reproductive health challenges facing women in Lancaster County today?
So as I kind of pondered this question, there are several, I think, that we're dealing with presently. One, I feel, is just an overall kind of widening of the disparities in patients receiving prenatal care. We also have reduced access to just reproductive services in general. For example, we know one of our Planned Parenthood sites that kind of targeted our Lancaster County recently stopped accepting Medicaid, especially due to financial losses, which had forced a lot of patients to either travel further or have to pay out of pocket for reproductive care. We also see higher rates now of maternal mental health issues, which causes great changes and issues with both maternal as well as fetal outcomes. We're also seeing an increase in the number of substance use disorders, and that has greatly also impacted reproductive and maternal health as well as fetal health. And I also think overall there's just an increase in various medical conditions for our moms, such as hypertension, preeclampsia, and other underlying conditions, which also have caused issues and varying outcomes for both mom as well as baby.
I've heard mental health mentioned, I think, from each of our panelists at this point. And I was going to go to Dr. Smith, and I know she's working in real time here. She said she may have to step out. Is she here?
I'm sorry, I'm here. I apologize.
No worries, no worries. So she mentioned she might have to step out briefly, but Dr. Smith, thinking about mental health. So as a family medicine physician, you see patients across all stages of life. What trends are you noticing in women's health, particularly related to chronic illnesses and mental health?
So when it comes to mental health, a lot of what I'm seeing is anxiety and depression at different stages, whether it's a new diagnosis, long-standing. I see a lot of women who have undiagnosed ADHD or symptoms consistent with an ADHD diagnosis. And then a lot of burnout. Working in the medical field, I mean, we see a lot of burnout related to the medical field, but I think just burnout across the board. You talk about the number of hats that we wear. Women are the heads of households. Women are working. Women are managing, children at home. Women are managing a lot of other things outside of work, and this contributes to a lot of burnout and a lot of, I mean, just what I hear people say, I'm just tired. I'm just tired. And so from a mental health perspective, that's what we're seeing in terms of chronic conditions, especially with the increase in weight loss medications. Obesity and weight treatment is a big topic within our office and something we see women come to the table to discuss very, very often. I'm sure that the other physicians already touched on this, but perimenopause, especially in the last couple of months since the black box warning from hormone replacement therapy has been removed, we see a lot of patients coming in wanting to talk about perimenopause symptoms and options for hormone replacement, and then just general heart health. So the American College of Cardiology recently updated their lipid guidelines, and they are more stringent. And so being more proactive about having these discussions with our patients, what these numbers mean, and how we need to be more intensive and intentional with, reducing cholesterol numbers and to, long term reduce their risk of heart disease and stroke.
Thank you.
Mhm.
Ashley, you spoke about this a little bit in your first answer, but can you share how healthcare systems are evolving and maybe give an example of how specifically your healthcare system is working to meet the needs of women and families, particularly those who are underserved?
Mm-hmm. Forgive me, I have a little soapbox here, which I'll try to stay off of. But at the macro level, health systems and medicine in general just need to better understand women. So many of you might not know, it wasn't until 1993 that US law required the inclusion of women in clinical trials and just medical research. So just much is not known still about sex and gender differences in medicine. So progress has been made, but women are still significantly underrepresented in medical research, and much of the focus, at least initially, was focused on reproduction. So things like perimenopause and menopause, we hear a lot about that now in women's health, but there's still a lot that's just not known. So from an equity perspective, health systems have been focused on screening, and that's kind of come up already too. Screening for social factors, extending resources geared toward women and families to help with proactive, responsive support, and generally just navigation of those barriers. So at Penn Medicine LGH, some examples of these programs would be things like our Nurse Family Partnership or Healthy Beginnings Plus. These are programs available to income eligible women that offer specific supports both to themselves and their children during pregnancy and beyond. We also have I'm looking at the chat too. We also have a family medicine residency program, and our residents do a community health rotation. And so on the community health side, we're really intentional about trying to expose young doctors to things that we encounter here, particularly among underserved communities in Lancaster. And we encourage them to bring fresh insight and ideas to help us better meet the needs of our patient populations, primarily in Lancaster and not exclusive to Lancaster General, but generally just within the broader community that we serve.
Yeah, thank you.
Mm-hmm.
Dr. Powell, you talked a little bit about delayed care. So what patterns are you seeing, such as delayed care, the preventable conditions that point to the barriers maybe that we've discussed or that we haven't, that women are facing in accessing kind of some preventative or primary care?
One of the things that we need to do as health systems is stop the messaging that early treatment is overreacting in women. And so that pervasive thought exists out there in our EMS communities and other areas of healthcare, where if a woman presents soon, somehow she is anxious and or overreacting. So that's one of the barriers, is what is our messaging? How are we changing that? I think women, much like everybody else, face the same social determinants of health around food access, around housing access. So WellSpan has done a lot in both of these spaces. I think that some of those barriers and some of the partnerships that we can create with our community partners will help health systems better understand. I think there aren't great listening platforms where our community partners could possibly create a listening for some of these barriers that then the health care systems could help to solve. So we do a lot of screening in the emergency department around social determinants of health, but we're seeing people at their most vulnerable moment. And it's sometimes not the best space to ask about whether they are experiencing homelessness or food insecurities. And so those screening tools are less effective in that setting. And once somebody's stabilized from an emergency standpoint, we really need our community partners to kind of step up into the space and help us do some of that listening so that we can translate those into real actionable items in the healthcare space. And so this dialogue today is really important for how we're going to collaborate moving forward to close some of those gaps.
I love that. You make a great point of opening up spaces for listening, providing that opportunity for folks to share. Yeah, that's great. Dr. McDonald, what opportunities exist for earlier intervention or some community-based support that could help improve women's health outcomes from your perspective?
So a couple of the opportunities out there have already been spoken to by Ashley, the Nurse Family Partnership, as well as the Healthy Beginnings Plus. We also have the YWCA of Lancaster that's actually partnered with Mama La Lachera. And they actually have started to host a weekly postpartum support group that's actually dedicated to providing moms with a nurturing as well as supportive environment for new mothers. Most of our institutions also have begun to start postpartum and prenatal classes, which is a really great opportunity for moms and families to get together and also have the support from other women who are of a similar gestational age to be able to ask your peers if you have any questions, and also, realize that you're not the only one going through something. You also have others in your group that are going through that as well. There's also the organization Patients Are Waiting, and that's really great and they're dedicated to eliminating healthcare disparities by trying to increase diversity in medicine. So they actually provide community education classes as well as doula support. And they also have a number of pipeline programs to try to get some of our younger generation involved in healthcare as well. And then also we have a number of things going on kind of on the statewide front. One, for example, is Thriving PA, which is actually a campaign that's advocating for better maternal coverage. So some of their initiatives so far have been including Medicaid reimbursement for doula services, which I think is really, really great, as well as establishing a perinatal psychiatric access pilot program. A number of us have alluded to mental health in this arena, and so I think those are really great things that are going on.
That's great. Thank you for sharing about the advocacy piece as well. That's great. Dr. Smith. When you think about preventative care and education and the role it plays in improving health, how do you think we can do a better job of connecting women to these resources?
I think just making sure that we know what is available. So when you talk about something like treatment of obesity, that is not just here's a medication, see you in a few months. There's so many different pillars to that. There's the nutrition component, there's the exercise component, there's managing mental health, there's sleep, there's alcohol use, tobacco use. It is a lot for one provider to manage all of those pillars. So knowing what kind of resources are available in terms of nutrition, what kind of nutrition support is available in the community, in terms of exercise, what kinds of programs are available. Are there programs that are geared towards specifically women that might be a more comfortable environment for women who have not really had an exercise routine? In terms of mental health, I utilize a lot of resources from Mental Health America quite a bit. I refer patients to their program. One of the biggest issues I see in terms of mental health is access to counseling and therapy. So whether that is just physical access, there are no appointments, or their insurance doesn't cover, or the wait list is 6 months long. I refer a lot of patients to MHA's Community Mental Health Assistance Program to at least establish them with care for counseling and therapy. I think that plays a huge role, not only in obesity management, but just the mental health component as well, being able to have someone to talk to. And then just making sure that patients understand where they're going, why they're going there, what resources they have access to. But I think just understanding all of the interconnectedness of our community and how we can get our women where they need to be.
Yeah, that's great. And yes, Dr. Powell, go ahead.
I just wanted to pick up on something Dr. Smith said around navigation. So this is one of the most complicated parts is that healthcare used to be a whole lot simpler 50 years ago. And I think particularly patients just don't know where to go anymore. And how can our community partners and health systems make this a little bit more simpler, particularly for women? If I have chest pain, how do I know whether that's to the ED, to the family care? We're often pressing 1, pressing 7 when we call numbers. And so there's a tremendous amount of opportunity, particularly with our community partners, to create more navigation for females in Lancaster County. And so I'm very passionate about navigation because I feel like as an emergency physician, this is what I do all day long. People come into the ER and I'm really just helping them to navigate their health care to get to the right next space. So if every community partner also had those or had some of those resources embedded, you do a great job, I think, getting people to the right food or the right housing resource. But how can we as health systems help you also navigate some of those basic healthcare needs in our community?
Great thought. Anyone else on the panel have any comments in that space in regards to kind of community partnerships or navigating the healthcare system?
The only comment I would have is I'm not local to Lancaster. I've lived here for 6 years. I've learned a lot about the medical system since living here. I started work in this office in April of 20, so it was the beginning of COVID. It was a terrible time to have started out in a new area, in a new office. And a lot of what I've learned, I learned about the medical system from my colleagues, but I learned about a lot of community resources directly from my patients. My patients will come in and say, I'm going to this specific place, and I'm jotting down names of places. I think having some resource that, as a primary care provider, some resource that is available to us or someone who is coming out to the primary care providers, because I agree, I think with what Dr. Powell said, you end up with a lot of people not knowing where to go, and they end up in the ER for an issue that really should have been dealt with in the primary care setting. But being able to have those resources available to the providers and having the providers know what all of the resources are. I mean, I think that would be a huge benefit because if we have them, we can more easily hand them over to patients.
Yeah. I would be remiss, and my United Way friends would not be happy if I didn't take an opportunity to remind folks that PA 211 is a great resource that's available by phone, by text, online. It's free, and that's something you can refer your patients to. Also, Find Help is another great tool, just a database of available resources throughout the state of Pennsylvania. So I'm just going to make a quick plug for that. Let's see, we do have a few questions here that I want to make sure that we can get to. And okay. Dr. McDonald, the prenatal and postpartum groups you mentioned is a formal education group or a support group that is run by participants?
So for example, the one that we have currently going on through Lancaster Medical Center, it's actually, we have them at periodic times throughout the year, and it's actually run by many of our labor and delivery nurses and postpartum nurses as well.
Thank you. We got a really intuitive question here. I think it's an important one. How are we serving our patients and clients with intellectual disabilities? This particular attendee says she feels this is an area that needs to be greatly addressed.
I'll chip in here a little bit, Brooke. I mean, we here at WellSpan have CAD, which is Center for, and again, I can never get the entire acronym out. I've been calling it CAD for a long time. So that's one way. So what are the embedded resources in the community, and how are health systems partnering with those? There's also Aaron's Acres. What we really rely on when the two have to interface are strong relationships with those organizations and also great communications with families. Does there need to be more work in this space? Absolutely. We have launched here at WellSpan also another level of training, particularly in our emergency departments for individuals with neurocognitive spectrum disorders. And that's not only in the young, but also expanding into the elderly. So we train all of our frontline team members on how to interact with patients with neurocognitive deficits. So we're taking baby steps in this space. The more communication and, again, listening spaces where we can understand what you need from us are going to help inform how we train our team members. And what else is needed in this space? I think healthcare spends a lot of time sort of guessing what people need rather than actually knowing. And so, again, just to sort of reiterate, we're here, we want to know, and if we can create those platforms to get that information, I think we'll be able to better serve the community.
Thank you. Any of the other panelists have anything to add?
Brooke, I'll just add that it's obviously an area of need, and I think robust collaboration and conversation, and frankly, just identification of resources and navigation of patients and families to those resources is probably a good place to start. But once you start those conversations, at least broadly outside of our own individual organizations or our individual contexts, there's probably unmet needs that we might not just be aware of even at this conversation today. So that then begets some additional program development.
Thank you. There's another question in the chat, and Dr. McDonald, I'm thinking maybe this would be most appropriate for you. What is the best way for patients to communicate with their OBGYN if they believe they have endometriosis or I'm not going to say that right.
Adenomyosis.
You got it. And that's why you're the professional. And that they'd like to be referred to a specialist for diseases so they can have an earlier treatment plan. Do you have any suggestions or guidance?
Yeah, I think this is a really great question because it's something that I think we see really often. And especially when we were talking earlier about kind of getting in later to care. I think this is probably, especially in endometriosis, which we're now knowing and finding out is largely a pain component. But a lot of patients are coming to me after going to other providers where they weren't felt that their concerns were really addressed. And, I usually say to my patients, if it's something that is distressing to you, is causing a major issue in your life, right? You can't go to work, right? It's affecting your ability to have quality time with your kids, with your spouse. We can no longer say, you're a woman, you're going to have pain, this is going to be your period, this is going to be your life. There are so many things that we can do to address these issues. And so, I always start, even if you're just coming to me for an annual, I want to know kind of what has changed, right? What is distressing for you as a patient? I focus a lot on, any pain, right? Any changes with the cycle, any issues that may start earlier. Same thing with adenomyosis. Adenomyosis has a huge pain component, and many patients don't know about it. And so usually I try to get a gauge. A lot of times patients will say, well, like, what is normal? Well, there's really no normal, right? If it's something that's changing from what you're used to, or even if it's something that you're concerned about, I think you should always bring it up. And, with respect to, how can you broach that conversation? I think, one, you have to be with a provider that you're comfortable with, so that and who's going to also be willing to have that exchange with you as a patient, to kind of delve into those deep questions and those symptoms that a lot of people may not be comfortable with doing. And there are plenty of specialists, especially in this arena. Endometriosis, for example, we have our minimally invasive GYN colleagues in GYN who are great endometriosis experts. And so I am, a big proponent of getting kind of a team that will be able to help us kind of delve and, be able to offer to patients the myriad of kind of tools that we have. It's not just, throwing medicine at patients, in my opinion, but there are other things that we can address, right? Is it something structurally? Can we help with pelvic floor physical therapy? There are a bunch of new meds also on both hormonal and non-hormonal, which can help. And so I think, just getting back to the original question, kind of, as soon as you come in, bring your concerns to your provider, so that, your provider can delve a little bit deeper. And it's always, better to say it, upright and in the beginning, so that as the person who set up the question, so that we can be able to try to intervene sooner, and then also, get the rest of our team members on board.
That's great. Thank you. I'm going to pull another one from the chat here. Kim shared a good point, and she said Lancaster is really rich with resources. Figuring out how to connect can be challenging, especially in mental health. A lot of times people need folks to walk alongside them, not just give a phone number. And then she kind of poses a question to all of you to say, thinking about navigating through the health system, what would the dream or ideal system be for physicians navigating care?
If we're talking the dream system, it would be that every single specialty that you have within your healthcare system is positioned together, so that I have a patient who comes in with chest pain and I can say, great, let me get you down to cardiology. They're on the next floor. That's in an ideal world. That can't happen because we have how many different primary care offices, and you can't have a specialty office with each center. I'm going to say something that might not be favorable for some of the healthcare systems. One of the biggest issues I see is not the providers within the healthcare systems, but the administrators or the healthcare systems themselves, not always willing to navigate towards other healthcare systems. I work with UPMC. I feel like there is always a big push to keep people within UPMC. But if there is a program at WellSpan or a program at LGH that is going to fit my patients better, I am going to do what is best for my patient 100% of the time. Again, I don't think any of this is coming from providers. I think a lot of this is coming from the healthcare system, but learning how to break down some of those walls so that we can work to serve our community and not serve our healthcare systems, I think would be an enormous win.
Thank you. Anyone else have thoughts on that?
So much like Dr. Smith, in my dream world, we would lower the barrier to sharing all the wealth of resources amongst us as large health systems. But I would say more importantly for me, particularly for women, would be the changer in the payer strategy world, where it would not take a physician 17 phone calls to get a study or a test approved for anybody who's seeking care. And so there are so many barriers that patients aren't aware of that our providers go through every day in order to get people the care that they need. And so we really need payer reform in a lot of ways in order to streamline the navigation process. So even if I, the doctor, want something for you, there may be 17 additional hoops that I have to jump through to get you the thing that you need. And that's really burning out our physicians and our advanced practice providers who don't really want to spend their time on the phone with insurance companies, but would prefer to spend that time in front of patients. And yes, we are going to, as of this fall, have one medical record in Lancaster County, people. So it's coming. We are excited about this, that we will all be on the same platform. I am also looking forward to that. So just wait until the fall of 2026. We shall be able to see everything.
Thank you.
I'd like to just kind of echo, I love what Dr. Powell just said. And going back to the question from, I think it was Kim, she had mentioned walking alongside the patient. I mean, in an ideal world, yes, but like Dr. Powell mentioned, we're ordering a test and there's 17 hoops to jump through. And there was a statistic I saw recently, and I believe this was referring to primary care physicians, but female primary care physicians end up doing 25% more work than their male physicians because just because of the way that they practice medicine. And so the rate of burnout in women in primary care is higher. And so, yes, in an ideal world, we would walk alongside the patients, but I can't walk alongside all 18 patients that I see every day that I'm seeing patients in the office. And so having other people to do that and being able to just kind of get them started. So setting them on that yellow brick road and saying, here is my plan, here is what I would like you to do. But I can't physically be the one to follow that up. I don't have the time or the energy, but having a system that has someone that follows up. Within our system, we have a behavioral healthcare program. I place a referral to the program, and if I am managing someone's psychiatric needs, we have a licensed clinical social worker and a psychiatrist that will then review the chart. The licensed clinical social worker reaches out on a routine basis to the patient, and the psychiatrist comes back and says, I see what you're doing. Here are my recommendations. Let me know if you have any other questions. Having more resources like that across all of the other fields would be hugely beneficial.
Thank you. There's one question I want to give each of our panelists a quick opportunity to weigh in on here. When you think about the whole landscape of Lancaster County, where do you see the greatest opportunity for collaboration between healthcare providers, nonprofits, community leaders? Where are there those intersections that could really drive some meaningful change in this space, in your opinions?
I can start. In my opinion, the greatest opportunity for collaboration is just collaboration itself. Honest, true, transparent collaboration. I think it starts with data. So all of us moving to one EMR platform is exciting, but generally each of us, and this is beyond just healthcare systems too. This is other service provider organizations locally. We all have different pieces of the data, right? So we see what we can see, but using what is available to us individually to better understand the aggregate picture of what people in Lancaster County need from us, I think is what the opportunity is. And then what that allows for then is for each of us, whether it's a healthcare system or a service provider, or municipal government, frankly. I mean, this allows us to deploy our individual resources strategically and really rally around a set of needs with intention, each bringing our unique talents and our own resources to bear so that we can collectively respond. And when we respond together, our impact is just much greater. So.
Thank you.
Mm-hmm.
I will add two quick things to that. I think it would be helpful to have direct scheduling within community organizations prior to discharge from hospitals. That's still a tremendous gap where we have to use community caseworkers and other things to try and do this after people have left our space, which is always much more difficult than when we have them as a captive audience, either in the emergency department or in our inpatient setting or in one of our ambulatory practices. And so how do we create more of that direct scheduling? And also a shared tracking and referral system. So if I refer somebody for food services, I have no way of knowing whether that referral's been completed, whether that gap has been closed. Then they come back to the hospital or the care setting and we just have no idea. And so how can we as a community and a county create one shared referral system? And the answer is yes, some of that is done through Epic, but not all of our community partners participate in that shared communication. And so we could use way more transparency in the referral process piece.
Thank you. Any other thoughts on community collaborations that would be helping to drive some great change in this space?
More listening platforms. This is one of these great opportunities here, this call, but we have to hear people and we have to see people and they have to be seen and heard. And there's just not enough space for that true collaboration that Ashley described. And so if you're able to create, if the United Way and other partners are able to create those spaces, I think healthcare would be present to listen.
That's great. I know that we're nearing the end of an hour, which went so fast already. And I believe there might have been a hand up, but if you have a question, please feel free to pop that in the chat as we near the end here. And then we can kind of address any last minute questions. There were so many great conversations here, great things happening. And I think to your point, Dr. Powell, there's a lot of opportunity to consider ways community partners can engage with health systems and how we can work alongside each other to improve opportunity for the people that we're serving, right? Has anyone outside of 211 tried compiling a list of resources based on need? I would say, I know there's also the online tool through the state. I don't know what it's called today. At one time it was called Find Help. I think it has 10 different names depending on what system it's integrated into. And that's also a pretty comprehensive database. There is also from 211, I know they do publish as well a Find Help guide, kind of a where to call guide. Again, once you kind of print things, they can become outdated. So I would say looking at an online tool would probably be the best way to find the most up-to-date resources and information.
Brooke, I can add one thing, and I'm a little bit out of my wheelhouse.
Yeah.
But there's also an online tool locally available. I don't think it's exclusively local, called PA Navigate. And I think some of our service providers locally, you can create a listing more or less. It's more or less like a directory of some of these possible referral platforms, I believe. I'm peripheral to that conversation, but I don't know a lot more. I don't have a lot more to offer, but I'm just throwing it out there that if for those who are interested, maybe worth exploring the PA Navigate platform.
Yeah. Great, thank you. And that's what I was thinking of when I said Find Help, PA Navigate. I knew it was kind of a statewide initiative.
There it is. It's in the chat. There's a link now. Thank you, Joyce.
Thank you. Wonderful. Here's a question. Do you feel the ability to self-diagnose, whether through internet or AI, has created more anxiety for patients? Do we have any ideas on how people can weed through myth and fact? I mean, certainly I think with the introduction of AI, people have a lot at their fingertips. How would you respond to that as practitioners?
I'm happy to hop in here too. I think the amount of misinformation and disinformation in the world has exponentially multiplied. And so you eventually have to trust somebody. And that, in my mind, goes back to these wonderful providers in front of us. Find that person that you can trust. That's not to say that you shouldn't and couldn't use these tools, and they're helpful in all kinds of spaces. But at the end of the day, you have to have a trusted resource. And so whoever that's going to be for you, I encourage you to make that a physician or a provider of some sort. But I think AI is here to stay and has many useful applications in healthcare.
Thank you. Okay. As we near the 12 o'clock hour, I think we're going to move to wrap up here. I hope from this conversation, it's really clear that improving women's health in Lancaster County takes everybody. It's going to take community organizations, healthcare providers, individuals, everybody working together. If you are feeling if you're feeling inspired to become part of that impact, I hope you'll join United Way on May 19th for the Women United event. As Christy mentioned, even if you're not a member and you want to learn more, please come. It's from 5:30 to 7:30 at the Lancaster Chamber. It's going to be a great opportunity to connect and to hear more from some community organizations who have some possible programming that they're looking to implement into this space to help improve women's health. So we'd love to have you as we continue building a healthier, stronger Lancaster County together. I thank you to all the panelists. Thank you so much for your expertise. I know you have very busy schedules, so thank you for the time you've given to this space as well. We really appreciate it. And I hope all of you have a great rest of your day. Thank you.